Good afternoon, and welcome back to What Matters Gulf Coast. Well, ladies and gentlemen, we survived Mardi Gras. It was a grand time, and we had some beautiful weather for Mardi Gras. God was good to us. And now, since Ash Wednesday, the Wednesday after Mardi Gras, Fat Tuesday, we are into the lengthened season. And of course, at that time, people give up or people start something during these 40 days of Lent, which will culminate at Easter time. So we're well into the season. It looks as if our weather is going to cooperate with us. Luckily, we're not on the West Coast, which they're having all kinds of difficulties out there, but we pray for them and wish the best for them also. We are back today, and remember, this is our last Sunday in the month, which we devote to our health and our mental health. Today, we only have one half of that team. We have our health expert, and she is about to come on. Of course, it is our resident registered nurse, Miss Yolanda Long. So the next person you hear from will be Miss Yolanda Long.
Hello, everybody. The last time we were together, we discussed those that we set back in December for the new year, which included whether we were going to start a new exercise regimen, whether we were going to just start eating better, sleeping more, or getting adequate sleep, or just making a few lifestyle modification changes in our lives that would help us to have a better quality of life, or that would help us to keep sickness and illnesses at bay. So now we're going to start tying in how all of those changes can really help us. The first thing we're going to talk about this afternoon rather, is colorectal cancer. March is recognizing colorectal cancer, and we want to look at saving lives with prevention awareness. Colorectal cancer is the second deadliest cancer in the United States. Every March, National Colorectal Cancer Awareness Month spotlights this disease and inspires more people to get checked starting at the age of 45. We have always been told to get those colonoscopies after age 50. Well, with so many undiagnosed cases, or by the time we go in at 50, it's just so far progressed, they lowered it down to the age of 45. And that is the wonderful thing. It has been proven to be saving lives. With the screenings, we can find the warning signs of colon and rectal cancer, letting doctors and other healthcare providers take action to prevent the disease. Screening can also find colorectal cancer early when treatment is most effective. And that's what we're aiming towards. Even if we have some suspicions and it's just not colorectal cancer at that time. The Cologuard is one of the tests that you can use at home, mail it back, and get results. Or you can go into your healthcare provider, a gastroenterologist, and they can do a colonoscopy to keep you in good GI health. When I say GI, gastroenterology health, dealing with your it deals from the esophagus all the way to your rectum, And so they can look for different types of cancers. So I urge you all to do that. 1 in 24 people will be diagnosed with colorectal cancer in their lifetime, but you can make a difference today by becoming aware, supporting colorectal cancer fundraisers and awareness, and providing information to the community. And just remember, tomorrow cannot wait. If you're over the age of 45, I suggest you go and get that test done. And hopefully it will come back negative. But if it does come back positive, there's treatment and we have procedures that can help you get through this. Another topic that I would like to discuss this afternoon is deep vein thrombosis. This issue is looked at or observed in March as well. Deep vein thrombosis is a blood clot that develops usually in the legs, but it can develop anywhere. Blood clots impede blood flow from flowing back to the heart. They can be dangerous if part of it breaks loose and travels to the lungs, which it can produce a PE. That's what one of the Williams sisters had. I don't remember which one of them had it. Or it can go to the heart if it's a clot and cause a heart attack. Or it can go to the brain and cause a clot within the brain, causing a stroke. So we want to let you know that you do not need to sit, lie down, or just be sluggish or stagnant during the day. We need to be getting up and walking or standing at least every hour. So many of us work at computers all day and we don't do that. And usually people that travel a lot in the air, they end up with blood clots because they are not getting up. If they're sitting for long periods of time, this can happen. So I just want to caution you about that. If your job or your lifestyle allows you to travel, be mindful of DVTs. The risk factors for DVTs include venous stasis or stagnant, sluggish flow. We talked about that. Sitting down, kind of being lazy. So if you can, I know a lot of people cannot stand on their own or walk on their own, but if you have a loved one that cannot do that, please help them ambulate, help them stand, help them walk as much as you can. Another factor is hypercoagulation, which is thick blood. And this is what this does is allow the blood to clot more and cause a blood clot. And the third thing is damage to the lining of the blood vessel wall, and this can be from trauma or surgery. So most of the time after, let's say, a knee replacement, they're going to put compression hose on you in the hospital, or they're going to put on something we call sequential pumps on your legs. And what they're going to do is keep the blood flowing. And that's what we want to do to prevent blood clots. Various medical conditions put you more at risk for developing a blood clot. They include, but are not limited to, like I said, recent surgery, pregnancy, cancer, and trauma. Approximately 1 in 1,000 people will develop a DVT in their lifetime. Signs of DVTs are swelling of the leg, pain in the leg, redness, warmth, and many people do not even show signs and symptoms of DVTs. For this reason, I caution people when they go to nail salons and they may offer a package that the technician may offer to massage your calves. I always opt out of that because you don't know if you have a clot or not, and you do not want anyone dislodging that clot or sending it forth in your body. We have medications for that that would dissolve the clot. And if you're prone to clot, we have procedures for that that will literally catch the clot and stop it from flowing to your heart, to your lung, to your brain, elsewhere in the body. So keep those things in mind. I talked to you about ambulating, keeping blood moving and circulating within the body. The last thing I would like to talk to you about this afternoon is chronic kidney disease. Chronic kidney disease is a progressive loss in kidney function over a period of months or years. It can even be over a couple of weeks, or if you have acute kidney disease, that can throw you into chronic kidney disease. Each of your kidneys has about a million tiny filters called nephrons. And what we want to do is we want to keep those working. With kidney disease, we don't want to put extra work on the nephrons. We don't want to put extra work on your kidneys. We do not want your kidneys to shut down. So, with that said, we need to be seeing our doctors as often as we can. Some people say every 3 months. If you know you have chronic kidney disease, yes, every 3 months. But if you have hypertension and diabetes and high cholesterol, you should see them every 6 months. And the reason why I'm saying that is because these are all factors. This is not the all inclusive list, but these are all factors that lead to kidney disease. And we want to make sure you're checking your A1C. We want to make sure you're checking your triglycerides. We want to make certain that you're checking your blood pressure because all of these can lead to chronic kidney disease. I started off talking about those things that we were doing or committed to do at the beginning of the year. Those things, that list of things I gave you, if you pick two or three or even one, such as ambulating can help with colorectal cancer. Ambulating can help with blood clots. Ambulating can help with the prevention of kidney disease. You know why? Because it's exercising, it's getting out, it's getting moving. And when we talked about the chronic kidney disease, ambulating lowers blood pressure and it can help regulate your blood glucose because you want to make sure that you're doing um, that you're burning some of those calories and um, we're getting rid of we're using some of that stored fat and sugar in the body, so that's a good thing. With DVTs, we talked about it helping with the clots. Colorectal cancer, when you ambulate, drink water, that keeps your bowels moving and that stops toxins from settling within the colon and it keeps you regular. And these are my tips for this week. And I'm just hoping we're all staying on track with our goals for healthcare. And I encourage you to do so. It's not easy, but we are here. We're here to support you, and you can do this. Have a fantastic week.
We want to thank our guest, and she always brings to us helpful information in the health field. We want to thank her. She always gives us reminders of things that we need to be paying attention to and signs and symptoms of these different illnesses that we can stay on top of. So, folks, let's make sure we take advantage of this helpful health information. You're getting this information absolutely free. In most cases, you would end up having to go to your doctor to hear some of the information that this person, this nurse, is giving to us. So let's make sure we take advantage of that. We also want to thank you again for joining us today. And we want to invite you back next Sunday at 4 o'clock. Thank you for joining us. And please join us again next Sunday at the 4 p.m. time. Thank you and have a wonderful, blessed evening.